Good morning, everyone. In the next minutes, I'm going to present you an overview on long-term outcomes of anti-VEGF treatment for myopic CNV. We know that myopic CNV is a prevalent and vision-threatening complication associated with pathologic myopia, and it affects up to 11% of eyes with PHAM. Multiple clinical trials and real-world experience underlined the pivotal role of such therapy for this condition. However, we don't know exactly, and we do not have such large evidence on what is going on the long term. So we designed the present study with the aim to bridge this gap. And we aim to sum up all the existing evidence through a stepwise methodology, including a systematic literature review, a meta-analysis, and a meta-regression. We performed a systematic literature review in the major databases with the aim to detect studies describing naive patients with myopic CNV, focusing on changes in best-corrected visual acuity. 80 studies describing and detailing approximately 150 populations with more than 5,000 eyes were included in the present research. And here are the results of the meta-analysis, and as you can see, there is a strong improvement in visual acuity that was maintained over more than 5 years of follow-up, though there was some decline over time. We have a plus 12 letters at 1 year, and then this outcome declines over time till the approximately 5 letters at 5 or more years. A meta-regression is a statistical technique that allows to answer specific questions. And the first question here is, how does BCVA gains change over time? And the answer is that there is a decline after the initial visual gain of approximately 1.2 letters per year of follow-up. So patients are losing 1.2 letters for each year of follow-up after an initial gain of approximately 12 letters. Meta-regression was also able to detect other factors impacting the visual gains, and one is the age at baseline. For each decade of age at baseline, patients have a minus 2.4 ATDRS letters outcomes in the long term. And as can be seen and as it is expected, we also have patients with worse baseline best corrected visual acuity that gain the most, even in the long term. The meta-regression found no statistical influence on the type of anti-VEGF drug, nor regarding the frequency of the treatment on the long-term outcomes. This research has some limitation. The major one is that we have different quality in the studies included, and so it can be that there is some publication bias, there is some selection bias, and even ecological bias. However, the techniques we employed, such as the potential publication bias analysis and the one-study effect analysis, showed our results to be robust. So to sum up, anti-VEGF therapy is highly effective, not only in the first years after treatment, but this effect is sustained over the years, even after 5 years of follow-up. Thank you for your attention.
Thank you. For the sake of time, we will move on.
So yes, we're running out of time, but at the end we will ask questions.